Here we have carpal tunnel syndrome. If you are watching this video, I hope that the educational printout was of value to you. This video will go over the material that was in the printout that you received on your first day, but the material will be a little bit more elaborated on. During your first visit, your therapist would have determined whether you needed an orthosis or a splint. They might have made you a wrist cock-up orthosis to relieve your symptoms of carpal tunnel. Your hand therapist also would have recommended when to wear the orthosis or splint. They would have checked off at all times, nighttime only, or any other time that might have been written down in your educational printout. Splints can be washed using cold water or wiped with an alcohol pad. If you use hot or warm water, the splint can mold into a different shape and it would not be used correctly. Here on this slide, we will be talking about prefabricated braces. These items can be purchased at your local Walmart, CVS, Rite Aid, whatever store that might be close to you. These items can also be purchased online on an Amazon or any of the sites or the stores that I mentioned, like Walmart, Rite Aid, CVS, whatever it might be. These braces are considered to be a wrist cock-up so that you're able to position your wrist in a position to decrease your symptoms of carpal tunnel. The wear time is the same time that was marked off in the previous slide. And then you want to make sure you wear it loose enough so that you can fit one finger in between the skin and the brace so that it is not too tight. So what is carpal tunnel syndrome? Carpal tunnel syndrome is the compression of the median nerve. I will talk a little bit later down the line how the nerve is compressed over time. The median nerve is a nerve that travels down the palm side of the forearm, past the wrist, and up until certain fingertips. The compression occurs at the carpal tunnel, which is within the palm side of a person's wrist crease. So if you were to bend your wrist forward and bend your hand forward, right where it starts to bend, right about there, at that point is the carpal tunnel. The thumb, index finger, middle finger, and half of the ring finger that's closest to the middle finger are the affected fingers when the nerve is compressed. Here are some symptoms that you might be experiencing with carpal tunnel syndrome. The injury will create the following symptoms in the hand: numbness and tingling in the thumb, index finger, middle finger, and the ring finger. Numbness and tingling that is often worse at night because it might be in a flexed position. Dropping items, especially smaller items. Discomfort in the wrist, hands, and fingers that are associated with carpal tunnel syndrome. And a weak pinch, whatever it is that you might be pinching. Here we'll be talking about causes of carpal tunnel syndrome. Generally speaking, carpal tunnel syndrome is developed over time, doing the same movements over and over again. Carpal tunnel syndrome occurs from repetitive elbow and wrist flexion over time, so bending your wrist forward and back over time for long periods of time will contribute to carpal tunnel syndrome. It can also develop from a lack of blood flow at the wrist area or from metabolic changes in the body. Metabolic changes in the body can develop most commonly in the following people: people who smoke, who have nutritional deficiencies, who have autoimmune diseases or diabetes. Women are more likely than men to develop carpal tunnel syndrome, and other risk factors in developing carpal syndrome include the following: obesity, hypothyroidism, fibromyalgia, and pregnancy. So the most common question asked about any condition is, how long will this last for? With carpal tunnel syndrome, it's a little bit different because everybody's recovery time is different. The recovery from nerve compression depends on how long the nerve has been compressed for any nerve at all. So if you've been experiencing carpal tunnel syndrome for a long period of time, say years, then it'll take you a little bit longer to recover from carpal tunnel syndrome. Carpal tunnel syndrome can be treated through occupational therapy or hand therapy to relieve the symptoms of pain, numbness, and tingling, like we talked about earlier. The severity of the compression, or how bad the actual compression of the nerve is commonly determined by an EMG, short for electromyography, but we're going to call it EMG for this video's sake. That's something the doctor must have done already to you before you come to therapy. Through surgery, pressure can be released, removing symptoms over time. On average, after surgery, occupational or hand therapy can last around 4 to 6 weeks, maybe even less depending on how bad the compression was, or maybe even more depending on how bad the compression was. Therapy can help with scar management after surgical procedure, range of motion, and strength during this time. Here we talk about modality use and its benefits, specifically heat in this case. Heat can be in the form of a hot pack, or you can create your own hot pack by filling a bag or a sock with uncooked rice, heating it up for 30 seconds at a time until it is warm, and then you can apply the heat source on your wrist. You can apply the heat for 10 to 15 minutes at a time with 2 layers of towels between the skin and the heat source so that you do not burn. Benefits of heat include the following: relief of pain, increase of blood flow, which in turn promotes healing of the area, improves extensibility or loosens up the muscles in the area, and decreases stiffness of the area. So here is the starting exercise for your home exercise program that you received in your educational printout during the first day. Here we have pictured in the top left corner, you're going to start off with your hands nice and flat. You're going to curl the tips of your fingers and the middle knuckles down as pictured in the second picture. Moving on to the third picture, we're going to make a full fist. And then going to the fourth picture, we are going to make a 90-degree angle with your fingers being horizontal, nice and straight, and then your hand being vertical, nice and straight. And then the fifth step, pictured in the bottom left corner, we will fold your fingers at the middle knuckles of your hand, and then you will start all over again, going back up to the top left corner. The reps and sets were given and written down on the educational printout during your first visit. Here we have some more home exercises for your program. We have wrist flexion and extension, otherwise moving your hand forward and backwards. You'll start with your hand nice and flat as pictured all the way to the left. You'll start to move your hand forward like the picture in the middle. You're going to move forward as much as you can go. If it's a little too extraneous, the pain, ease up and not go as much as you would. And then I want you to move your hand all the way back into extension, again, as much as you can go, like the picture all the way to the right. Every week you'll be aiming to go a little bit further each time, but to start off we'll do what we can. And again, you'll follow the reps and sets that are on your educational material printout. Here is an exercise that we like to call towel crawls. What you're going to do is start with your hand flat and palm down on the table with the towel underneath your hand. Then you will curl your fingers to scrunch the towel underneath, as pictured in the bottom right corner. And then you will straighten your fingers out so that it'll look just like the top right corner and go back to the first step. You would repeat this step continuously. The last exercise in this home exercise program are median nerve glides. To do these median nerve glides, what you want to do is have your hand nice and flat, whether your elbow is on a table or your arm is up in the air. That's your preference, but you want to start with your hand nice and flat as pictured in the top left corner of the video. Next, you want to bend your wrist backwards as pictured in the second picture. You then want to separate your thumb from the rest of the hand. See how there's a gap between the thumb and the rest of the fingers. You want it to look like that in the third picture. Then, in the fourth picture, in the top right corner, while your wrist is bent backwards and your thumb is separated, you want to turn your forearm and wrist the other way, like you're holding a tray, and then you want to straighten your elbow out, as pictured in the bottom left picture, and then you want to act as if you're putting the tray down. That's the last step for a median nerve glide, and then you will repeat and go back to the first step that's pictured in the top left corner.